and welcome to our group presentation on Provena Covenant Medical Center versus the Department of Revenue. My name is Christine, and my partners in this project were Kelly, Josh, Marquita, and Marion. So we can start by talking about how the case got to the Illinois Supreme Court. Originally, the Department of Revenue denied Provena Covenant Medical Center, or PCMC, their charitable exemption for their 2002 property taxes. Provena Healthcare filed a complaint with the Circuit Court of Sangamon County in which they agreed with Provena Hospital that they should receive the exemption. The Department of Revenue appealed, and it went to the appellate court, which reversed the decision in favor of the Department of Revenue. And so now it is under the review of the Illinois Supreme Court. The facts of the case. So Provena Covenant Medical Center had a net gain of $2,165,388 in 2002. Only $6,938 of their income was due to charitable donations, which means the majority of their profits came from providing services to residents. There is no record as to where these profits were reinvested. Typically, a nonprofit hospital takes any excess revenue that they gain and they invest it back into the hospital. So they'll build a new wing, they'll get new equipment, they'll hire more staff, put it into a fund so they can give out more charity, but they didn't have any records as to what they did with their profits. Charity was not freely given. Every person had to apply and would be disqualified if their home was over $10,000 or their assets were greater than $5,000. As a side note, that is a pretty generous charity program. Most state Medicaid programs require you to be under $2,000 in your assets. So they're helping out that middle group. The charity program only waived an actual cost of $831,000, or 0.7% of their total revenue. As far as patients, only 0.27% were granted charity. If PCMC loses this case, they would owe $1.1 million in property taxes to the Department of Revenue. Initially, no claims were made for religious exemption. Those claims came after they were originally denied their application. So the issue, as previously stated, is that Provena Healthcare is distributing the property taxes on the grounds of charitable donations and religious exemptions. The decision was that Provena Healthcare would owe property taxes because they did not receive an exemption for charitable donations or religious exemptions. There are 5 characteristics of a charitable institution, and these 5 reasons are what helped the court decide whether or not they qualified. First, they have no stock, capital, or shareholders. Second, it is the primary funded by charities, and they place these funds in a trust. They do not earn a profit or dividends. Charity is given to all that need it and apply for it. It does not provide gain or profit to those that associate with it. So that would be like giving stocks to high-rise employees. And they do not place obstacles in the ways of those who need the charitable benefits. The court agreed that number 1 and number 4 were met because they did not have any stocks or capital. Number 2, which talked about how the facility was mainly funded by charity and charitable donations, was decided that it did not qualify. As stated in the facts, only $6,923 of charitable donations were received by PCMC. In fact, all of their profits seem to come from net patient service revenue, which is the exact same as a for-profit hospital and any other institution in healthcare. So they did not qualify for the second criteria of a charitable institution. The third criteria is charity is given to all that need it and apply for it. There was not very many records of where the charity was given, and they could not really provide evidence that it was given freely to all that needed it. There were 13% of the residents in that area that were below the federal poverty level and would need these charitable services. However, as stated in the facts, only 0.27% of the population received charitable donations. So, really, if they're going to get charity care, it should be closer to this 13% if they're all below the federal poverty level. But instead, it's a minuscule amount. So, what happened to the other 12%? Well, we'll see later on in this presentation. In addition, only 302 of the cases of the 110,000 admissions were given charity care. It was very minuscule, the number of charity cases they gave. So it was not given to all that needed it and applied for it. So number 5, they did not place obstacles in the way of those who needed charitable benefits. One of the biggest mistakes that PCMC made was they did not advertise the charity benefits. They said there were no advertisements up. It wasn't something that was discussed. It was more of a last-ditch effort. Most patients would come, they would bill their initial insurance, and then there would be co-insurance or private pay that was due. And so then it would be sent to their business office, and their business office would do 3 or 4 collection efforts and then send it to a collection service. And the collection service would try to get as many assets as they could. And then at that point, if they didn't get any money, they would then revert it to charity care. They would lower their prices, but it would still warrant them a profit. And really, honestly, their practices are not much different than any other healthcare setting with their bad debt. I mean, in the nursing home, we do the exact same thing. We make our initial contact. Usually these people tell us that they don't have anything or to leave them alone. And so then we do our collection efforts. Once those are exhausted, we send it up to the collection referral team. At that point, we get our lawyer involved. We take them to court if they have assets. If they don't, we basically send a demand letter. And when they ignore the demand letter, we write it off. It is basically charity because we provided the care and we did not receive payment. Does that make us a nonprofit? No. It's just a part of doing business in the healthcare setting. And so because it wasn't necessarily a charity program, it was more they couldn't pay, so I guess that counts as our charity. The court didn't feel that they were really providing the charity care that would warrant a property tax exemption. Another argument that Provena had was we were only looking at the self-pay or the private pay portion of the charity care. They felt that because they treated Medicare and Medicaid patients, and Medicare and Medicaid, especially Medicaid, pays at a much lower rate than your traditional insurances, that should be considered as a part of their charity care. However, the court disagreed, stating that they did not need to take Medicare and Medicaid patients. Simply having the contract allowed them to bring in revenue that they otherwise wouldn't have. And so really having the contract was a benefit to them, and they weren't really doing a service to the community. They were really servicing themselves. Considering the majority of your hospital admissions are for those over the age of 65, having a Medicare contract would be very beneficial to a major hospital. And so it's really not considered charity, even though the rates are lower than what they want or what they get out of other insurances. And then we go on to the religious exemptions. So as I said previously, the religious exemption was not a part of the original application. It was almost like a last-ditch effort. And the court felt that they did not qualify because their whole thought process was, well, we're Catholic, we're a Catholic hospital, so we're religious. Well, the court viewed that as any devout person could really be doing things for Christ and being and getting this property exemption. That's not how it works. Just because I'm religious and I work at my workplace does not mean that my workplace gets an exemption. Just because my company was founded by a religious person does not mean that the company receives the religious exemption. Instead, they defined it as you had to be a place of worship in order to get a religious exemption. And so let's talk about some of the counter arguments and dissenting opinions. So some of the other arguments that Provena had was they said that they provide charity by just being a member of the community. They have community outreach and programs that wouldn't be there if they weren't there, because there really wasn't sufficient evidence of that. And they felt like they really weren't this beacon for the community. The court basically threw this out and said, there's no evidence that your presence is a charity. Another reason that they said that they should be getting the exemption is they said that their bad debt is equal to charity care. Every facility has bad debt. It's part of the game. You bring in somebody that doesn't have the payer source, you take a portion of that money every month and put it towards your bad debt, and it comes off your revenue because you know you're not going to get it. So when you admit a homeless person, you know that they're not going to pay their copays. So it's just a part of business. They felt that they couldn't give them the exemption based off bad debt because then that means that every institution would qualify with their bad debt. And usually bad debt can be mismanagement, not necessarily charity care, because bad debt is for all payers, not just private pay. So if they billed late or didn't bill correctly and they were denied timely filing, that would go against their bad debt. But that doesn't mean they're providing charity. That means that they were not managing their funds correctly. One of their other reasons was they said that their rates were lower than the general population, all the other hospitals nearby, and so that should be considered charity. The court threw this out saying basically that they were still able to make a profit, which they were, even with the lower rates. So it's really not charity because they're still making an income off these rates. They might not be ideal, but they're still making money. And as stated previously, they talked about how Medicare and Medicaid patients should be considered charity, and they threw it out. Now, not everyone was in full agreement with this decision. Justice Burke and Justice Freeman did file a dissenting opinion in which they said that you really can't put a monetary value on the charity care provided. They felt it was unfair to say they didn't provide enough dollars of charity care. They felt that the law really didn't have a dollar amount, and so you really couldn't say they didn't provide enough charity care. Now, the other requirements of the charity institution they agreed with, but they just felt that you couldn't put a monetary value on it. So let's talk about what this case did for the state of Illinois and healthcare in general. So right after this case was won by the Department of Revenue, 5 other hospitals were also stripped of their property tax exemption. They all had percentages of less than 1% of their revenue being going towards charity, and in general their property tax gain would be more than what they actually gave out in charity. And then to top it all off, the governor, Pat Quinn, enacted a law that stated exactly that. The charitable donations cannot be less than what you would gain from a property tax exemption. So in the case of Provena, if you remember, it talked about how the amount of charity care that was given was $800,000 and the property taxes was $1.1 million. In that case, they would not qualify for the property tax exemption because their charity care is basically $300,000 short of what you would be gaining by the property tax exemption. And finally, there was a discussion of what this means for nonprofits in the future. A lot of nonprofits have very little cash on hand, about 20 days or so, and having to pay property taxes would bankrupt them. A lot of people in the community said that they wanted the money to stay with these hospitals because it meant that they'd reinvest and they'd get better health outcomes in the future. But, there was also the opinion of we need to regulate these hospitals. They're getting these exemptions. The money's going towards their bottom line. It's going towards executives and not to the communities that actually need it. And so there was definitely a debate as to whether or not this law was needed and whether or not these hospitals need to be regulated, because they felt like the property taxes would give services to other people in the community that would be far greater importance than building a new wing of the hospital, or, as they were saying, giving it to more executives and raising salaries. They just felt like there was not enough focus as to where these monies were going, and that they shouldn't be exempt if they were basically making a profit and were not giving the same amount of charity as they were receiving from this exemption. So overall, this case delved into a lot of interesting things about nonprofit hospitals and really helped us to think of what really constitutes as a charitable institution and what dangers and changes nonprofit hospitals are facing in the future. The longer it goes, the more strict they're going to be on these type of exemptions. And I think that they need to be aware of the fact that their exemption is a privilege and not a guarantee. And as they continue to make charity care their focus instead of their profits, then they will be a true nonprofit hospital and will be deserving of the public's money through the tax exemption. We hope that you enjoyed this presentation and had learned a lot about this case. Thank you.